Asphyxial deaths can result to a lot of neck structures can be damaged in such cases where fatal pressures are put on the neck and the asphyxial deaths has occurred. So a lot of important structures are found in the neck, and that basically includes the thyroid cartilages as well, the thyroid itself, the larynx, the trachea. All of these are basically very important, and they basically play a pivotal role in the breathing phenomena, in the respiratory, being a part of the respiratory tract. So if they are damaged, that is going to basically prove fatal for the person. So even the direct blows to the neck or the manual strangulations or the hanging phenomena, all of them can result in the damage to the larynx. So that is going to be proving quite fatal for the person whosoever is under such a condition. Now in this section, we'll be dealing with the spurious bleeding behind the larynx. So in case the larynx is damaged, that is going to lead into bleeding bleeding after in the internal structures as well as behind the larynx, and that is going to be quite fatal for the person. Hematomas can occur, and even the soft tissues can be involved in this. Now the injury to the larynx itself can prove to be quite fatal, and the damage to the carotid arteries is again going to be quite significant over here. Again, the baroreceptors, they basically come into play, and the mechanism of the cardiac arrest the cycle of the mechanism of the cardiac arrest is going to start. So this vicious cycle has to be stopped. And in case you are dealing in emergency with any damage to the larynx, you have to keep these points in your mind. What are the autopsy appearances in such cases, and how is it significant? All of this will be discussed over here in this section. Now, the spurious bleeding behind the larynx is quite evident, and this banding phenomena is quite commonly seen whenever the larynx is damaged. So, the endoscopic appearance is shown in this picture over here, and you can see this banding phenomena, and that is basically going to point out towards the bleeding through the larynx. The larynx has been damaged. There has been a fatal pressure on the neck that basically caused this damage to the larynx. The substantial hemorrhages over the esophagus, anterior longitudinal ligament, that is the cervical spine, is involved in a lot of cases. So all of this is basically going to point out towards the spurious bleeding behind the larynx. Now, banding of the esophagus, the pale areas in the esophagus that are again going to be highlighted over here. If they are seen on any autopsy appearances, they are going to be noted down in the autopsy reports, whosoever is writing the autopsy report. The tissue congestion is noted on endoscopic examination or even on a naked eye examination. If there is any sort of a tissue congestion, that is going to basically mark the asphyxial deaths. So post-mortem hypostasis is again very common over here, and that is going to be noted over here. Again, we are going to basically see that in cases of the post-mortem hypostasis is quite evident over here, and that is going to be noted down. Of course, the color of the hypostasis and then again the sites of the hypostasis are again quite common over here. So just to give you an overview, this diagram is over there, and you will see that this is basically the epiglottis over here. And then we have the greater horn of the hyoid bone on right and the left sides. We have the thyrohyoid membrane in between this greater horn of the hyoid bone, and this is basically placed over here. Then we have the thyroid cartilage over here, and here we have the arytenoid cartilages. Again, we have the tracheal structures over here, and the larynx is somewhat here. Lying above the trachea. So all of these structures have to be kept in mind whenever we are considering the respiratory passages and how they can be damaged after putting pressures. The manual strangulation is quite commonly seen. The pressures are bilateral over here. The sides of the larynx can be squeezed in such cases of injury to the larynx, and the horns are displaced inwards. So that has to be kept in mind, that the horns have been displaced inwards, sufficiently calcified to cause the fracture of the larynx as well. Loose or flapping termination is seen in such a case. Again, it can be cut down, thyrohyoid ligament, it can be cut down in such cases. And hemorrhage at the fracture site is again a very common phenomena which is seen whenever we are dealing with injuries to the larynx. There are jagged edges and there are brittle horns whenever injury to the larynx occurs. The radiography before dissection is very important over here. The hyoid bone marker of violence is basically seen over here. And the larynx is basically damaged whenever the hyoid bone is damaged. The plates are broken. It can be broken spirally or it can be broken obliquely. In such cases, severe damage and disruption occurs after this damage to the larynx or the laryngeal structures. Whenever it occurs, it's basically quite disrupting and quite fatal, proves quite fatal for the person. So, significance of laryngeal fractures, whenever we are discussing it, they can be grouped into basically these five groups. That is, the first group mainly comprises of the minor endolaryngeal hematoma. Then in the second group, we have the minor mucosal disruption or the non-displaced fracture on the CT scan. In the third group, we have the massive edema, large tears or exposed cartilages. In the fourth group, we have the massive trauma with multiple fractures. And finally, in the fifth group, we have the complete laryngeotracheal separation seen. So these are basically the major five groups of the laryngeal trauma. They are the indicators of pressure applied to the neck. Only a fractured horn is not indicative of violence, and it prove it to be an ante-mortem in origin. So it basically proves that it is of an ante-mortem origin. This injury is of an ante-mortem origin and it didn't occur after the death of the person. The damaged laryngeal plate is seen in a lot of cases. Clumsy removal of the tongue or neck is done, and it breaks the thyroid or hyoid coronae. So it's basically, it can be even done during the autopsy procedure. So that has to be kept in mind. The proof of the ante-mortem laryngeal fracture is that the hemorrhage at the fracture site is seen. There is prominent bleeding. Blood blebs are seen under the periosteum or the perichondrium. They are palpable broken ends of the calcified horns. Red cell extravasation is also seen in such cases. So basically, whenever we are differentiating between any ante-mortem or any post-mortem injury or lesion, the basic difference lies whenever there are inflammatory signs. So if inflammatory signs are found, there's basically the nature of injury is ante-mortem. That is the highlight over here. So the surface bruises are again going to be quite evident over here, and we are going to focus on them. What kind of surface bruises are found, what are their sizes and their number. All of it is noted down in the autopsy report. And then the scratches are again very important. If there are any abrasions or scratches, are there linear scratches or they are the curved scratches, they are going to be noted down depending upon their shape and depending upon their number. Now, moving on, we'll be discussing the intralaryngeal and the tongue hemorrhages as well over here. The tongue hemorrhages or the intralaryngeal hemorrhages, if they are found, they have to be documented in detail in the autopsy report. The other laryngeal injuries in strangulation that are usually seen are the splitting of the ala of the thyroid cartilages. Violent strangulation is seen in such cases, and substantial trauma, whatever has been found, has to be documented in detail. Cricoid cartilage fractures are again very important, as well as the thyroid and the hyoid bone fractures. They are quite predominant over here in manual throttling, and they are severely displaced whenever strangulation has occurred. The mucosal tearing and the bleeding is again quite common over here, and partial airway obstruction is seen in such cases. Cyanotic discoloration is observed in a lot of cases, and there is an obstructive venous return in such cases. Deep congestion is noted. The signs of the engorged vessels, they're all noted down in the autopsy report. Hemorrhages into the mucosal lining, if they are found, they have to be documented in detail in the autopsy report. Now, damage to the carotid arteries. This diagram over here, it basically emphasizes on the factors that there are very important structures lying in the neck, including the lingual artery, the superior thyroid artery, the external carotid arteries, and the internal carotid arteries. So these structures can be damaged whenever fatal pressures have been applied to the neck. Vagal inhibition of the type of vagal inhibition basically occurs in these type of deaths. There are pressures on baroreceptors, and that basically results in the cardiac arrest. Deep hemorrhages in the neck tissues occur. Cardiac arrest occurs, and the intimal tear or the bleeding occurs after this phenomena. Artifactual damage is one of the factors that has to be kept in mind, because even during performance of the autopsy, these carotid arteries can be damaged. So one has to look for a complete picture rather than just a single injury. Cyanotic petechial appearances are noted down, and they have to be noted down in detail if they are found. For example, petechial hemorrhages are cyanotic in nature, and if they are found around the eye and the eye structures are involved in such a case, then they have to be noted down. History assists in the interpretation, so there should be a complete history behind all the findings, and all the clues must be interlinked to each other. Only then it can be a leading investigation. So in this section, basically we dealt with the laryngeal trauma and how it can affect the investigation, and what are the autopsy appearances in such cases. That is the end to this section. Thank you for watching sqadia.com.